This is an interesting time and an interesting opportunity that we've got in that we have changed the way we communicate in just about every facet of our lives. And in our medical communication, this is our opportunity to really change the way we communicate with our physicians, with our patients, with other ancillary staff, among each other, and Harmony's portal is the way we're going to do that. MyChart is the name that we are going to be using for this, and it's exactly what it is. It's your chart, or it's MyChart, and it's a full access portal, meaning that it gives you the information for test results, lab results. You can see summaries of chart visits. You can see notes from your physician. You can ask your provider for information. You can request an appointment. You can schedule an appointment. You can do inquiries about labs. You can do inquiries about anything. It is true two-way communication between the patient and the provider. So how might we use the portal? Well, there's lots and lots of ways to use the portal. As I mentioned, you can schedule an appointment through a portal. You can see what dates are available. You don't just have to call. You can actually access at 3 o'clock in the morning when you're sitting there. You can say what times are available for me to see my doctor. You can schedule that way. You can ask a question. Now, emergency questions are handled emergently, and they're not handled through portal. But a question that says, hey, I've got this thing that's bothering me, do I need to be seen? And then that is triaged through a nurse, and the nurse would either call for more information, send you a question back, or schedule an appointment as appropriate. MyChart is designed, it is a modern interface, and so it's available on your iPad, it's available on your iPhone, it's available on any other smartphone, it's available on your home computer, it's available just about any way that you would access information. Now, I mentioned scheduling, but you can also, if you had labs yesterday, then as soon as your doctor has looked at those labs, they become immediately available to you, so you can see the results. Your doctor can annotate those labs that says, hey, your hemoglobin's a little bit low, we need to do some further testing. Or your doctor might send you a note that says you're doing so well with your diabetes and your cholesterol looks great, keep up the good work. So you can have immediate access. Again, whenever you have the time in your busy schedule, you can access those results. You can see the interpretation of those results, and you can get a message or give a message regarding those results. In other words, you might look at those labs and say, hey, my neutrophil count looks a little odd. It has an L beside it. Does this mean anything? And so you can have true two-way communication. And again, one of the characteristics of this day and age is we want you to be more responsible for your health. We want to do our part, and we want to make available all the tools that you can possibly have to do your part. But this allows you to have more insight and more information and better access, and so you can respond almost instantly to anything that you need to know. MyChart is radically different. It's very well established. It has proven interactivity. It has an incredible reliability rating, so we're not going to have downtime on it. We're not going to have a, hey, your password doesn't work anymore, you're going to have to come in and do something. We're just not going to have the challenges that we were faced. And again, it has been demonstrated to be an invaluable tool both from the healthcare provider side and the patient side in doing everything from gaining insight into your health situation to asking for refills and things like that. So it really sets the standard and is the standard, defines the standard for portals around the world. Everybody that you come in contact with during your office visits and most of the people during your hospital stay are capable of signing you up for MyChart. So whether you're in the hospital or in the clinic, sign up for MyChart. If you're not, you can even access us online and sign up for MyChart.